living in the positive. And I know good will conquer evil.
This is a day for good stories on Power Talk. I'm so happy. Bishop Craig Brown, welcome home.
Thank you very much.
Happy to have you. Bishop Dr. Craig Brown, the founder and president of Zion Care International. A week has passed since we were with you at Vauxhall High, and the annual mission that Zion Care sponsors has been completed. But I didn't want it just to end like that. We wanted to have you give a recap, Bishop, as to why this mission takes place year after year, how successful, if it is, that this year has been, and where do you go from here?
Well, first, good afternoon to the people of Jamaica.
Thank you.
This mission has been extremely successful. For the Vauxhall community, where dental is concerned, we saw 2,100 individuals.
In a week?
In 1 week.
Mercy.
These doctors were there from as early as 7 a.m. in the morning. People were there from as early as 6:30 to receive treatment.
Yes.
On the medical side at Vauxhall, we saw 915
people.
At
Swallowfield.
Whitehall, we saw 1,710 individuals for dental, and where medical is concerned, 915.
Yes.
We issued 516 prescriptions that were filled on the site also as we travel with our own
You bring
pharmacy.
the drugs, yes.
Yes, and pharmacies. So it has been a tremendous successful mission.
Who are these people who come?
Happy.
Who are these people who come? I'm remembering meeting Dr. Swan. This is a professor with a connection with Harvard University who comes down here year after year, Bishop Brown, to deal with people with dental problems. He's an oral physician, and he does it for free, and he does it with and finds satisfaction and happiness in doing that. That's a wonderful spirit, eh?
It is a wonderful spirit. We recruit not just dental people. We recruit the best in their field because charity begins at home. I am Jamaican by birth. And we go into the colleges and the well-known hospitals such as Montgomery and inspire them to come and to give back. And they pay their own way.
Mercy. Listen, I'm anxious that we do this because the people of Jamaica, even over and beyond the hundreds and thousands that you have mentioned, need to understand the greatness of spirit and the magnitude of the gift. And it's done very quietly. It's done without fanfare, and it shows what the human spirit, properly motivated, can in fact do.
Absolutely, Ronnie. It is one of the most fundamental responsibility we have in the church. In Acts 20, I believe it says, in all things I have shown you that by working hard in this way, we must help the weak and remember the words of the Lord Jesus. How he himself said, it is more blessed to give than to receive.
So tell me now, this, I'm sure there are many people who we want to give thanks to, and maybe you'll want to mention some of them, if not all, and I really want to know where you go from here.
Well, we want to recognize the people at Island Car Rental, the Courtly Hotel, Knoxford Court Hotel. We want to recognize the volunteers on the ground. My director down there, hard-working Camille Wilson, who single-handedly managed this project from start to finish. It's an arduous task, Ronnie, that involves a lot of manpower. We want to thank the sponsors, Kirk Distributors, who donated water to us. Ronnie, within the 1 week we were there, we went through 65 cases of water because it was so hot.
I'm glad. Go ahead.
You know? So where do we go from here? We are opening a clinic at Windward Road.
That's Holy Rosary.
Want to thank the Archbishop, the Roman Catholic Archbishop of Kingston, who basically gave us this building permission to go on. Yes. And from here now, we are putting together not just to operate this clinic, but this clinic will be the state-of-the-art clinic in that area because we're providing free diagnostic service, something that the poor readily doesn't have.
Hold on, Bishop. That means some of the tests that are used in modern medicine for diagnosis. So the doctor not just going to come or the nurse and sound you and say it looks like this, but rather you can get some of the testing that will make the diagnosis sure.
Absolutely, you're going to be able to do your EKG, your mammogram.
Wow.
And we're looking at the facility in terms of space to bring in a CAT scan machine. As a matter of fact, Ronnie, I signed a check this morning that completes the payment for the, I think it's the MRI machine that we intend to bring in there.
Well, that would be a tremendous help.
Absolutely.
Yeah.
Ronnie, our aim is to make healthcare accessible to the poor.
Now you realize that this is an objective that even in the developed country of the United States where you are, that is still elusive for many, although the efforts have and are being made. But for that to be made available for us here with limited funds and the limited capacities of what government can do despite their best efforts, this is a tremendous help. I hope that this can become available soon.
Within the next 6 months to a year at the most, clinics should be up. We're getting the architects to redesign and configure the building so it can accommodate what we would like there. And when I say redesign, I mean when the patients arrive, they are met in a dignified way and treated in the most professional way. You know, the fact that you're poor doesn't mean that you're regulated to receive substandard service.
Aye, sir. That's a key thing, because if people feel that they are being considered well, if they're given good service, in other words, and by people who aren't so stretched out and tired and frustrated that they lower those standards, that is a step towards healing right away, isn't it?
Absolutely. And you speak about healing. The healing our Father speaks about is not only spiritual, but it's also physical. This is what we're trying to do. The people we minister to, Ronnie, don't only have spiritual needs, they have physical, they have mental, they have financial. And we in the church have to see how we can cover all of these.
Yes. The Jamaica Medical Foundation have been friends of yours for a long time?
Great help. Listen, Orville Johnson has been a tower of strength.
Oliver Jones, Michael Fraser.
Oliver Jones, Old J. Listen to me. These guys have come and have helped us with the logistics. They have opened doors and an opportunity for us. And believe me, we couldn't have accomplished what we have without the Jamaica Medical Foundation. No way at all.
Well, that's
so I'm
great.
Grateful to them. And great Jamaican institution.
And we want to cement those partnerships and once again state how opposite, how good it is that in fact here's an international initiative. You are the bridge being Jamaican American, and here is a local organization which in fact can be a solvent and an assistance on this end. And when we put all the different capacities together, we get a wonderful product.
Absolutely. Ronnie, most times what we need is the will. We lack the will. And we look at the difficulties and we get discouraged. But when you look at the crisis in health, Ronnie, I made it a point of my duty to walk through these clinics and to talk to the average person sitting there. We have a serious problem in our country where health is concerned.
Oi. You just see this walking through.
Just walking through. We had one patient there who I think was suffering from Parkinson, and we ran out of the medication, and she went to a pharmacy to get it. I think the government said they didn't have what she needed, and she came back to us with the prescription. Ronnie, almost $40,000 to fill that prescription.
Oh, no. And that's it, everything fits together. Your depreciated currency, the lack of resources to the health sector. We're not blaming anybody. We're just saying that this is a predicament that you have to face.
This is the predicament the poor face on a daily basis.
Look at it. Tell me,
I want to say thanks to Dr. Natalie Wiley at KPH.
What a good person.
Who have been a tower of strength.
Yes.
Wonderful individuals.
Yes.
Phyllis Hall at the Ministry of Health. These people came and assist us.
I gather that one of your projects is to look at one of the wards at KPH and see if you can't help with some renewal there.
Well, we adopted the Mary C. Cole ward.
Yeah.
It's a 30-bed orthopedic ward. We have already, through connections we have here, have secured the 30 new beds.
Great.
We are waiting on some of the contractors to say how much they will commit and contributors to the project. But the furniture, what they need for the interior of the building is already here in New York. We are just trying to work out the logistics of who will pay for what.
Yes.
But it is going to be completed to the greater glory of God.
Thank you, sir. We count on that and believe it too. Bishop Craig Brown, the founder and chairman of Zion Care International, partnering with the Jamaican people and with so many others all around to offer the best health care in God's name to the poor.